Hello everyone, time for an update. My name is Michelle and this is my channel where I document my journey with stage 3 triple negative breast cancer and adrenal insufficiency, which is my leftover side effect from Keytruda immunotherapy. On today's video, I'm going to talk about what do we do now? I'm beyond 2 years after my diagnosis, and so that's our cancer anniversary date is July 18th, and that was 2 years. And so today is August 27th, so we're a couple months past my 2-year cancerversary, and I'm just providing an update. So one of the things I want to talk about is the kind of ongoing monitoring that they do for us with triple negative breast cancer after we're done with active treatment. Definitely what I am doing, what my oncology center recommends, is alternating between mammograms and MRIs every 6 months. So one and then the other and then the other. So mammogram and then 6 months later MRI, and then 6 months later mammogram, and 6 months later MRI. So the breast center is still monitoring me with scans. And then beyond that, I see my oncologist. I'm still seeing him about every 3 months, the medical oncologist. And I'm just, he checks in, he does an exam, we talk about any symptoms I'm having. And if there are any symptoms at all that could potentially be a cancer recurrence or metastases, then he sends me for testing. He also does regular blood work, so a comprehensive metabolic panel, CBC, and then sometimes my endocrinologist will also toss in some other orders for different types of blood work. So they check my body systems to make sure that everything is working as it should, and if there's any lingering effects. So my liver numbers still aren't quite back to what they were pre-cancer, but they're improving. They'll watch my thyroid because that could also be a potential issue with having had Keytruda. And so they are monitoring my systems. Okay, one thing that we don't do, that I'm not doing, is kind of ongoing regular blood tests to test for like cancer antigens or whatever. And there's a few different ones. They have numbers, either CA, and then there's numbers like 15.3 or 27.29 or 19.9 or 125. There's all these cancer antigens. The bigger, and the Signatera is the other kind of big one now that's popular and trendy. My oncology team doesn't really see a value in that. There's a lot of false positives, there's a lot of false negatives, and those false positives that my oncologist has seen have caused unnecessary anxiety, in his opinion. People see a little number there and they think, oh my God, there's cancer back in my body, but there's nothing actionable. If there's nothing on the scan, we don't know what to treat. My oncologist's recommendation on the blood work is, we'll test if there's a reason to test. So that's kind of my ongoing thing. I am having blood work, but it's not one of those cancer antigen tests. So what do we do when there is something, some weird symptom or new lump or something? So the first time that I brought a concern to my oncologist was in December of 2024. So just a reminder, my diagnosis date was July 18th, 2023. I started IV chemotherapy in August of 23. I had my first surgery, which was my partial mastectomy on the left breast, that's where the cancer was, and axillary dissection in the armpit on January 30th, 2024. Then I had radiation, and once I was healed from that, in October of 2024, October 28th, 2024, I had my breast reconstruction, which was a symmetry breast reduction on the other side so that they match and I'm not lopsided and I can, buy regular bras instead of needing something custom. So that breast reconstruction surgery on the right breast was October 28th, 2024. And about 2 months later, in December, I felt a lump in that breast that felt to me it had some form to it, as opposed to just being swelling. Because obviously up until then, as I was healing from surgery, I had some swelling around the scars and so forth. And so in December, I, mentioned at one of my appointments, yeah, I know there's this little area here that kind of feels like it's a lump as opposed to just swollen tissue. So they sent me at that time for a diagnostic mammogram and ultrasound. In fact, they did it that day. They walked me right into the radiology office and did an ultrasound and a mammogram. And then they had me come back for a biopsy because the ultrasound and mammogram, the radiology report interpretation said probably not cancer. There's the mass, probably benign. Which, if you've had cancer, is just not all that reassuring. And so, the radiologist is like, well, you could just monitor, retest in 6 months and see, or we can do a biopsy. So I opted for a biopsy because I didn't want to give it 6 months to grow if it was a recurrence of cancer. It was not. I had that biopsy. It was benign, and it was shown to be fat necrosis, which is very common after surgery, especially when they move things around, which they do for a breast reduction. They make it, well, I have a really good plastic surgeon and she made the match. They just about match. The difference in size and shape of my breasts now is probably the same as it was naturally before cancer. They weren't exactly the same size and shape then, and they're not exactly, but they're really close. I have an excellent plastic surgeon and I'm super happy with the results. So the fat necrosis is a common thing, and that area actually did kind of reabsorb and it went away. And then recently, so July 31st, 2025, I had another appointment. I was actually mentioning it to my physical therapist, actually, that this, the widespread kind of density that had been present had seemed to be becoming more localized, and maybe it's another area of fat necrosis, but it was hard. And so because I said there was a change, she had me walk over to the breast center, which is in the same building, and they again did an exam. They said, yeah, we should probably check that. And I was sent for a diagnostic mammogram and ultrasound again. This time, and so I'll show a picture. So these are the images from the ultrasound. That black area in the breast is the lump. And here's the radiology report. You can pause it if you want to see the measurements, but it says it appears benign. So in that picture, you can see the lump. Like you can see it's a pretty good size. I can feel it. It's very hard, but there is no blood supply to that. And so because of that, the radiologist came in and sat with me, and she is 100% confident that it is fat necrosis. And so, but she said sometimes these areas of fat necrosis can kind of get even denser and even calcify, and so it would be there pretty much permanently if it does that. And she said it looks like it might be doing that. So it'll be an area that we'll just always need to know, and we'll watch it to make sure that it doesn't change in size and shape. But it's the same thing again. Once they break up the tissue and move it around and reposition it in the breast, it's really common. And they don't do surgery on that, because if they take it out, and they have to cut me to take it out, then again, it can happen where I'll get the same thing will come back again, because they'll be repositioning everything. The other thing was I was having some new foot pain, and, my legs were hurting and my feet were hurting. And so they sent me for a bone scan, and this is not a bone density scan. It's a bone scan specifically looking for like the metabolism of bone cancer. So they're looking for bone cancer. And so they sent me for that. I complained about a new pain that felt like it was kind of deep in my joints and in my bones. And so they sent me for that scan, and that was also clear. I'll put that kind of the report here for a minute. I actually want to just tell you what a bone scan is. So yeah, a bone scan when they're looking for bone cancer is not just go in and out in 15, 20 minutes like a CAT scan would be. So you go in, they inject an IV radioactive tracer, and then that has to make its way into your bones. So they tell you to, go home and hydrate and then come back in 3 hours for the actual test. The test itself, 3 hours later, was 20 minutes, but it's a whole day process. So know that ahead of time. Here is the report. You can pause it if you'd like to read all of this technical jargon, but no evidence of cancer. So that's the bone scan. And so those are the things that I have been, the diagnostics that I've been sent for based on conversations I've had with my doctor about kind of new or concerning symptoms. Let me know if you are on this journey as well. What kind of diagnostic tests are you doing? For like monitoring after active treatment. I'm sure other people watching this video would love to hear about others' experiences as well. Everybody is a little bit different depending on where you're staged into. Like stage 4 cancer, they do that blood test monitoring to watch that number really closely with the circulating cancer cells or antigen. But if you've had you're done with active treatment and you don't have any evidence of cancer in your body, there's nothing to really monitor. You can look for that to pop up, but then if there's no tumor to test, then they don't know how to treat it and there's no treatment. And so, my oncologist explained that then people are just waiting for the cancer to show up so that they could test it, so that they could treat it. And if there's nothing to do, it just creates this kind of unnecessary anxiety. His advice, go live your life. And so that's my advice too. Just live. Yeah. That's my update. Have a great day. Enjoy the sunshine. I'm going to open this window now. I couldn't do it while I was filming because it just created a big glare. And we'll see you soon.